Hello from California. My name is Captain Anna Millerin. I am a chief resident at Travis Family Medicine Residency. I actually have recently been selected to stay on as faculty as well coming into this next year.
Hi there, and this is Major Michael Kim. I'm one of the faculty at Travis Air Force Base Family Medicine Residency, and we're excited to be here with you today over the next 40 to 45 minutes discussing vaccination during a COVID outbreak in the deployed setting and going over the lessons learned from this experience.
Just to briefly cover disclosures, we do not have any financial or non-financial interests to disclose. And just to introduce our shining faces, I am on the left, Anna Millerin, and Dr. Mike Kim is on the right. So, as Dr. Kim mentioned briefly, the learning outcomes today, we're going to review some of the published literature on vaccine hesitancy, focusing on the COVID-19 vaccine. We will discuss a real-life example in a deployed setting of a COVID outbreak. And with that, we will then focus on some strategies that you can apply in your practice setting. So really, to set the stage, I think it is important to be reminded of these statistics that we see on a daily basis. I think most of us are pretty overwhelmed at this point by the COVID pandemic, and unfortunately, at the end of or the beginning of this fall, most of us were hopeful that we were kind of in that downward trending trajectory of this virus's impact. Unfortunately, with now the Omicron variant taking hold, that is not the case. This data was pulled at the end of December when we were recording, and that data did show another spike in the number of cases. Similarly, we are seeing an uptick in deaths secondary to COVID-19. This slide is a little bit busy. I don't want you to read all of the things, but I will just highlight the U.S. number of deaths at this time, at the end of December, is now over 800,000, and the number of nationally vaccinated individuals is 61%. To contrast that, we have some data that was published from the Department of the Air Force in December of 2021, middle of December, that showed of our Air Force members, including civilians, dependents, and contractors, so those that we're caring for in our military facilities, there's over 75,000 that have recovered from the disease, but there have been 148 deaths. Something on more of a positive note is that in our Air Force population, we do have, in our active duty folks, 97.2% that are vaccinated. And again, to highlight the numbers of the national vaccination statistics, so this is per CDC data. 203 million fully vaccinated individuals. That makes up about 61% of the total population. A video that we thought was very helpful as we were learning more about this topic was one that was published in the Military Times, something that I would recommend you all take it about 5 minutes to watch this video. Really, it's talking a lot about what the military response was to the COVID vaccine prior to the mandate for individuals in the military to become vaccinated. Talking about kind of a lot of the techniques that were implemented, communication strategies, as well as helpful tips in terms of discussing this concern with younger populations, so largely that military population. So all of that background to set us up in the setting that we submitted this topic for discussion at conference back in the summer of 2021, when vaccines were not mandated yet in the military. It had actually not even been fully FDA approved at that time. And so really we wanted to talk about kind of what are those strategies in our setting that can be used to increase vaccination. Over the course of the last couple of months, the FDA has approved the vaccine. The military is now mandating the vaccine. But I think as primary care providers, regardless of a mandate, implementing positive communication strategies, getting people to come to the decision to get vaccinated for all of the benefits of vaccination is really what makes us good providers, good doctors. And so I think that, despite the fact that now our members are required to, I still think it's important for us to think about ways to most effectively talk about this vaccine and to potentially help save lives by increasing vaccination. So with that, a little bit of a definition. So vaccine hesitancy is a term that has come up now often in the COVID pandemic. It's not something that is new, though. It is something that has been present in many populations with respect to childhood vaccinations, adult vaccinations, but something that is very important in the setting of public health. So the definition of this term: the delay in the acceptance or refusal to vaccinate despite the availability of vaccine services. The World Health Organization has identified vaccine hesitancy as a global threat. In 2019, it was listed as one of the top 10 priorities of the World Health Organization. In 2020 and 2021, vaccine hesitancy, those words were not in the top 10 priorities, but that thought was incorporated into different ones of the global threats. And I think someone who has coined this, somebody that Dr. Kim will talk about a little bit later, one of the lieutenant colonels that was deployed in the same setting that he was, brings up frequently, and something I think is important to highlight when talking to our patients, is that, two of the things that have made the biggest difference in terms of medical technologies, in terms of saving lives, are vaccination and hand hygiene. Vaccines really can save lives, and as providers, it's so important for us to be communicating that with our patients, encouraging them to be vaccinated for themselves, but also for the population in general. So I promised I would talk about literature. That is what I am going to do. So the vaccine hesitancy is something that affects all of the U.S. population. It is more globally impacting the world as well, but because we are in the United States, we're going to focus more on those statistics. There have been a number of studies published looking at smaller populations, looking at their vaccine uptake rates, looking at different reasons why people are more or less hesitant. A study that I found to be most helpful in addressing this was a systematic review summarizing 65 studies with a total of over 313,000 individuals. The reasons that were identified, the population characteristics that were identified that had higher correlation with individuals being hesitant to get vaccination were race, gender, education level, location, and personal risk factors. So the race populations that were identified as having increased hesitancy was primarily African American individuals. There is a decent amount of kind of literature to suggest that there's a lot of reasons why there's higher hesitancy in the African American population, primarily being a history of really atrocities in medical research that have affected the African American population. And so that's kind of a big one. Gender, specifically females and childbearing or pregnant and breastfeeding females have been identified as a population with higher hesitancy. Education level, this has been identified as folks with lower education levels, specifically without a college education, are more likely to be hesitant towards vaccination. Location, this in the United States has been identified as those that live in more rural settings have higher rates of vaccination hesitancy. And personal risk factors, one that I thought was interesting that they studied was those that had had solid organ transplants. When studied, at least at the time of the investigation, they had higher rates of hesitancy than other populations. So another interesting population that has been studied is healthcare workers. Again, we have a great systematic review that we can rely on when looking at many of these smaller studies that have occurred in the last 2 to 3 years. This one was published in April of 2021 in the Journal of Community Health, and they summarized 35 studies with greater than 76,000 surveillants. The reasons that were identified in healthcare workers for having more vaccine hesitancy were safety of the vaccine, efficacy of the vaccine, level of education, and not having direct patient contact with individual, patients that have COVID. So I think it's important that we just take a second to focus on this population because this population is going to have a huge impact on our patient populations. So if we are, as healthcare workers, are not encouraging our colleagues, our friends, our family, the people that look up to us as healthcare providers, if we're not able to, consider getting the vaccine ourselves, then we're not going to be encouraging that in others, and that can lead to population decrease in vaccination levels. That being said, kind of the safety concerns, a lot of those were associated with how rapidly the vaccine was perceived to have come out, how rapidly that technology was perceived to have been rolled out, and so hopefully as we continue to get more information about the vaccines, we get more data on the potential health risks and health benefits of the vaccine, these statistics will change. But an interesting population, as this is us. And then finally, the third population that I want to highlight is the Air Force. Unfortunately, I don't have any systematic studies that were done in any of the other branches of the military, but there was a study that came out of Wright-Patterson Air Force Base. They had a population size of 816, and they were looking at perceptions and concerns regarding the vaccine. This study actually started as just a survey of their medical group, and what they found was that they had such high rates of vaccination hesitancy that they wanted to look at their global population on their base and kind of compare those things. And what they confirmed was that they did see a higher rate of hesitancy in their healthcare workers than they did in their non-healthcare workers on that base. Also, younger individuals, so those less than age 45, were seen to have higher rates of hesitancy. So what were some protective features that these studies highlighted? So certainly kind of the opposite of all of those things I listed. So age, older, wasn't classified specifically in most of those studies, but on an average, age greater than 45 years old was seen to be protective of hesitancy. Also being male gender. Level of education, I think I highlighted this a little bit earlier as well, but education more than a college degree, and even more vaccine uptake or higher rates of vaccination in those that have a doctorate level of education. Then exposure to the COVID in your work, exposure to patients affected by COVID, and then those with personal risk factors. So the personal risk factors, the comorbidities that were highlighted in a few of the studies were things like being on dialysis, having a diagnosis of cancer, were two that were strong protectors against hesitancy with the COVID vaccine. So, with all of that information about all of the populations that are hesitant to get vaccinated, the good news is that we have seen increased levels of vaccination even over the last couple of months. I highlight these dates specifically. So the CDC reports vaccination rates by time period in May of 2021, which is the time that Dr. Kim will pick up and start talking about his deployment. The rates of hesitancy to get the vaccine were about 31%. By November of this year, the rates were down to 17%. In the military population, this data stemming from the Air Force study that I had mentioned out of Wright-Patterson Air Force Base, at that time, the population hesitancy rate was about 23%. So the question is, leaves us with what worked? What are things that have gone on to increase vaccination uptake and decrease rates of hesitancy? So I will hand off to Dr. Kim.
All right, thanks so much, Dr. Miller, and that was an excellent review of currently what's out there in the literature. Thank you so much. And you're absolutely right. Regardless of the mandate, it really is our duty as healthcare professionals to really know this stuff and still be able to identify and counsel our patients on the importance of vaccination and kind of combat this vaccine hesitancy. We're specifically talking about COVID, but even beyond COVID. So thank you. So now going into a real-life example of a COVID outbreak that occurred during a deployed setting, to go over kind of how the literature can inform us in using some of these strategies moving forward, addressing vaccine hesitancy. So some facts really to be aware of for the outbreak. So our population on the installation at this deployed setting was a little over 3,000, and this consisted of airmen, soldiers, Marines, and contractors. It was identified as the largest COVID outbreak in the entire AOR, and not only that, by the Public Health Office, it was also identified as the largest outbreak of any infectious disease in the entire history of the installation. During this roughly 2-month time period, our two-man laboratory worked extremely hard, and they pumped out over 2,500 COVID test results of both of everything from symptomatic testing to contact tracing and travel testing. So this just kind of gives you an idea of the intensity of what we experienced during this outbreak as a small medical group. Okay, now I just want to give you a quick bird's eye view of the timeline that we were dealing with here. And just like Dr. Miller mentioned, Dr. Ray and her team of the medical group that was here prior really set the scene for us. So around November, when the vaccine rollout was occurring, they did an amazing job of getting education out there and vaccinations started. And so that's where we were at this point of the timeline. And then around the March-April timeframe was when a large pivot of personnel, from the deployed personnel, occurred. And so a lot of new people, but again, now these are people that have been informed a little bit about the vaccines and even possibly given a chance to get it. And then June, the beginning of June is when we started seeing our first cases on base. And roughly 1 month later is when we had the highest peak of the outbreak. And this continued in high intensity until August of 2021, when our last COVID patient was finally released from isolation. So that's a quick bird's eye view of the timeline we're dealing with, and a lot of things happening in between those little dots. So let's dive into some of the examples. This article from The Pulse, which is the USU's online news source, highlights the important work that Dr. Ray did with her team before the start of this outbreak during the vaccine rollout. And this consisted of a large-scale education initiative of face-to-face meetings with frank, hard, honest discussions, town hall style Q&A sessions, and a lot of creative ways where people really got to know their doctor. And that's one of the strategies we want to talk about to you. This article here reports that the medical group at the time was credited in vaccinating more than 1,300 individuals in less than 48 hours. So amazing work to start with here. Here's an example of just highlighting the importance of having a trusted personal physician as someone as a source of information that you can get your questions answered. And there's Dr. Ray doing a video shoot as part of this process. Now, here is the setting that we walked into. This is just, again, at that timeline, this is prior to the outbreak beginning, and this is around the time when that large pivot of incoming troops was occurring. Now, it's important to keep in mind that the group coming into this deployed environment have already been exposed to the initial vaccine effort rollout at home. And what happened was, upon in-processing, anyone who is getting deployed and entering the area and is not vaccinated, as part of their in-processing, are given a mandatory brief. And usually this was led by medical personnel, such as a provider or a nurse, and afterward offered the COVID-19 vaccine or a opportunity to opt out and document their decline status. Now, this picture here isn't me. It's from the same USU article. But that setting is exactly the same, where I would be standing in front of a large group of incoming young airmen or soldiers and going over the COVID vaccine and the benefits. And then afterward, I would stick around to answer any personal questions off to the side as a physician. And anecdotally, at this group of people coming in, really, there was a lot of things that were occurring that kind of made it so they were disinclined to get the vaccine at the time. A lot of it was they had already made up their mind before they even entered the AOR. And sometimes I even found a lot of it was personal pressure. But we're going to go into that in more detail later. For the outbreak itself, I believe this single graphical representation can best summarize some of the data and unpack some of the lessons as we move forward here. So I do want to orient you. The y-axis on the left-hand side shows the number of individuals with active COVID cases. These are the individuals that are in isolation or are hospitalized or transferred to a downtown hospital. And this corresponds to the blue vertical bars that you see. The y-axis on the right, instead of showing a number, shows a percentage of the installation's population who are vaccinated. The orange sections represent the fully vaccinated group, and the gray section is the group that has received at least one dose. And then on the x-axis shows the date spanning from 11 June to 10 August, and you can see that as the time progressed, there were some very clear, obvious, stepwise jumps in vaccination, which kind of was the trigger and inspiration for this talk. Here I'm highlighting the peak of the outbreak, and we had at the peak about 160 individuals in isolation, many of which required some form of medical attention. This horizontal line here represents the baseline vaccination rate prior to the start of the outbreak, and this was at about 50%. Now, as you can see, as the outbreak progressed and completed, we saw a sure but steady stepwise increase in the number of people getting vaccinated, and that top line there at the end of the outbreak highlights that about 70 just over 70% of the base population had received at least one dose or were fully vaccinated. And that difference there is about 20% highlighted by that vertical line. Okay, so that's that bird's eye timeline and overview and exactly what the statistics showed. So we're going to get into now what were the actual steps that were done throughout this process, targeting the vaccination hesitancy. And really, I wish there was one easy answer, but it was a team effort with multifactorial dimensions, really addressing all the realms that are affecting vaccine hesitancy. And a big one, probably the biggest one, is communication. And this comes in all forms. And of course, in classic Air Force style, the big one that we did was emails. And it's a little bit of a joke, but really, these emails were pivotal. And there were some elements of them that I want to point out that really made it so. And so the first one is it came directly from our installation commander. And these happened regularly. So everybody on base got regular updates throughout the outbreak about vaccination, about several mandates that we're going to go into, about the importance of vaccines. Everyone on base, whether you're a contractor or airman with one stripe or senior officer, got these emails. They were regular and they were very clear. They were also quite medically sound and accurate, and this is in large part credited to our leadership being very involved with the medical group. The other important thing that occurred in these emails that I saw was that our commander would regularly emphasize the importance that each individual, no matter their job, the importance that each person had on the mission and achieving the mission. And that really empowered everybody to be able to see how a seemingly simple act as vaccinating can really affect the entire team. Included in these emails were the same exact graphics. So that graphic that I showed you was actually the one pulled from an email near the end of the outbreak. And that really highlights the transparency that we had as a group and as leaders with the population. Within these emails, we also had several rules and regulations that were brought out in a stepwise fashion, and one might even say that kind of mirrored that stepwise improvements in vaccinations. But a lot of these were the mandates from public health oriented mandates. So the examples are mask wear and who had to wear one, where and when, dining hall, who can come and sit and eat and who had to take their food to go, the gathering size for meetings on base. And then this was a big one, was the privilege of off-base travel for leisure on non-mission critical events. At one point, vaccinated personnel were the only ones allowed to do that. And these communications also involved a lot of outbreak status and updates. And so people can see at a moment's glance that this is the number of people in isolation, here are the number of people in quarantine. So they can really see how the act of vaccinations can affect these sort of numbers. And going into that importance of that personal communication and face-to-face, yes, we did do the in-person meetings, but even little things and strategies that we use, such as our intraweb. So whenever a person came into work and logged onto their computer, they were greeted with a video. Usually it was of our installation commander or senior enlisted or public health officer. And in this example here, it's a video of our physician, again, talking about the importance of vaccination. So we had a completely multi-dimensional approach. Included in this and very specific and unique to our deployed setting was the use of the Air Force Connect app. Now, in the app, it's many uses for it. It's just communication tools, bus schedules, dining hall menus, but really the parts that I want to emphasize here and included are screenshots that how easily our troops can access accurate COVID information about the vaccine, ingredients, kind of the research that went into it, and that was completely integrated and linked into the app. So each person's smartphone had access to this, and we're highly encouraged upon in processing to download and create an account. I want to point out a couple things in here that I think were also pivotal to our success in improving vaccination rates during an outbreak. Again, going with the communication. So again, this is every single person, no matter their rank, has access to this Air Force Connect app. And so you can see here I highlighted two buttons called Ask the Commander and Ask the Chief. And this was a source where anyone, anytime can list questions and get real answers from our commander, from our chief, about what's going on and questions about it. And during the COVID outbreak, this was heavily used by the population and our leaders and to get information out there and address questions and offer good transparency. Sometimes it became humorous, and a good example of this is when we would get the commander would get very frank questions, such as something along the lines of, "Hey, why is my AC broken for so long, and it's taking so long for my work order to get fixed?" And the answer is, well, hey, it turns out most of the HVAC unit has COVID or are in quarantine. And so people really saw examples and transparency like that of how much of a difference vaccination can make. Also included was an easy way for someone to access medical information with that helping agency app. So the hours of the medical group and how to get vaccinations, or where and when to show up for vaccinations, and really trying to remove as many barriers as we can to make it easy for anyone to walk in or get answers or set up an appointment to have a face-to-face with a physician. These are some photos from one of our vaccination pods that we did. We had vaccination pods that lasted from 4 hours to 6 hours, and they occurred at all times throughout the night, throughout the day. Here we have it in the auditorium, but we also had it in other places around base, basically trying to make it as friendly as possible to the different shifts that people had and different places people worked. We also had on-site medical support for anyone with any specific questions to get addressed by a physician to make sure that they had all their questions answered about the vaccination. And you can see here that people are lined up in little rows or little pods that we called them to really maximize the use of each vial of vaccine, as each one, depending on the manufacturer, had a certain number of doses to give in a certain number of time, and we were determined to not waste a single one. Of course, during this time, the medical group that was there were still doing our normal job of responding to medical emergencies. We also, specifically for COVID, I did several physician consultations about very special cases. We had to consult some specialists via email and telephone as well. So anything that we can offer to help improve vaccination rates, in that regard, we did. The medical group also offered walk-in vaccination services. Usually we try to group it so we don't waste any doses. But really, any takers, we would bring them on in. And then, of course, the advanced medical care that we could provide up to and including requiring supplemental oxygen and other supportive care and treating other concomitant illnesses. As we stabilize patients and determine need for higher levels of care, we would coordinate admissions to the host nation hospitals and even sometimes medevac. And during the time of the outbreak, the entire country that we were in was also suffering from an outbreak as well. And so their hospitals were overflowing. And so sometimes we couldn't even transfer our patients there. We also provided over-the-counter supportive care for the large number of people in isolation and a sick call so every single day someone would go out to the isolation area and provide sick call to continue to provide supportive care and help try to identify anyone at higher risk of needing more advanced care as well.
Awesome. Thank you so much, Dr. Kim, for sharing those awesome examples of kind of techniques that can be applied in that setting. It's really cool to see how you guys integrated technology as well as that like interpersonal, like face-to-face time with your patients. And as we can see, that made a huge difference. You went from 50% to more than 70% of your population vaccinated. So this is such an awesome example of public health in action. And so the question comes to now, like, what can we as providers, stateside or in other deployed settings, do to help maximize the health of our populations, increase vaccination? So kind of the strategy that I'm going to share with you is based on a lot of the reading that I've done. I also took a mantra from a CME exercise that was published by the American Academy of Family Physicians in the last couple of months. And that mantra is engage, educate, vaccinate. So engage. What I mean by this is that we have to approach each patient that we see as an individual, bearing in mind that the reasons that people have for being concerned about vaccination are not because, they disagree with you or they don't trust you necessarily as their provider, but more often because they're concerned about their personal safety. They're concerned about their safety and the safety of their family, and they want to make the best decision for themselves. And so I think often in the heat of kind of meeting a patient that you may disagree with, it can be easy to take things personally, and really bearing in mind that our job is to be a resource to our patients, and we may not change their mind every time. So really just taking that to heart, that each individual deserves a individualized approach to their care. The second part of engaging with your patient is providing a safe space. So again, providing a space where you are communicating with your patient, you're listening to your patient. If you come into a clinic appointment and you're, guns a-blazing, I have all this data behind me to change your mind, in most communication settings, you're not going to get your point across because people shut down, they stop listening, especially when they disagree with what they're hearing. And so creating that safe space where you can be a resource to answer questions is going to be more impactful than you kind of listing off that information. And then collaborative communication, I think I kind of alluded to that a little bit, but really motivational interviewing and setting shared goals with your patient have seen to be much more effective than kind of this directive medical care. When a patient can come to a medical decision by themselves, when they have decided that they're ready for a treatment, that is going to be a much more long-sustaining treatment approach than if you were to just, tell them, today's the day, let's get this done. So collaborative communication when you engage with your patients. The second piece of the mantra is to educate. So we as providers are educators of our patients. And so having a clear message, having a clear understanding of the vaccine, and then that messaging out to your patients, having that messaging, be the same when communicating with your patient in the patient room, but also when they enter into their clinic, kind of the first things that they see at the front desk, having a unified response across your clinic makes a big difference. And in that, being educated yourself, as the research is giving us more information about COVID as a disease, as we're getting more information about the vaccine, its effect on individual bodies, its effect long-term, all of these things are changing on a daily basis, and it's our job as providers to be up to date on what that information is. I thought it was so cool to hear about the app that they used at that deployed setting, because patients were able to get those reliable resources at their fingertips. And so certainly a lot of our patients may not have the resources to technology where they can look this stuff up themselves. And so being a communicator that has a strong background in really that up-to-date information is what helps your patients trust you more, and also helps you be the provider that you should be. So us as providers being educated when we're helping our patients, and then being honest, because ultimately this information is changing on a daily basis. And even as a resident, when I'm constantly reading, I still will have an intern come up to me on occasion and be like, hey, have you read this new guideline? This stuff changes. And so being honest about what you know and the things that you need to read more about before you get back to that patient with an answer for is going to really, again, set that stage for a safe place and a reliable resource to your patients. And the third part of our mantra is to vaccinate. So people can't get vaccinated if they don't have access to the vaccine. This is kind of the key. In that deployed setting, they had that great example of setting up those vaccination pods. Patients were also able to communicate with their providers on a regular basis, set up times to get vaccinated if the pods didn't work for them. Similarly, in our populations all across the country, there's 100 different things that can be barriers for our patients in getting access to the vaccine. Certainly, transportation is one. I have the example of a patient that I recently took care of in the hospital. She was over 90 years old and had been kind of a shut-in for over a year in the setting of COVID. And her son, who was her caregiver, was so concerned about her going out that he hadn't gotten her to go in and get a vaccine. She was in the hospital for kind of unrelated things to COVID. She had been at home the whole time and thankfully not exposed. But she is a person whose life probably would have been significantly benefited if she had been able to get a vaccine potentially in the home, or there had been some sort of mobile access for her. And so I know that takes a lot of steps as a provider. Often we feel overwhelmed by all of the things that we're helping our patients do. But working with your medical team to help eliminate those barriers for your patients so that they can get access to vaccinations, and again, to really all of this with an effort to save lives and prevent the spread of this disease. Okay, wait. So before I get too much further, Dr. Kim, do you remember what our mantra is?
Oh, wow. Putting me on the spot. I believe it is engage, educate, vaccinate. Yay!
So mantras have been studied that they are an awesome tool for us as providers because they are something that we can fall back on when we potentially are getting frustrated, getting overwhelmed, getting bogged down in clinic. If we have that mantra, if we have kind of that background of why we're doing this and something to keep in mind when we're communicating with our patients, it can make a big difference. So engage, educate, vaccinate. The next piece that I'm just briefly going to touch on is mandates. So we talked about at the beginning of this presentation that when we first started doing this research, it was before the military had mandated the vaccine for COVID. Now we are seeing more populations than just the military that are mandating vaccines. Things like healthcare organizations, airlines, schools, some restaurants require vaccination or proof of vaccination to enter. And it's really an area where research is limited. So something that I think the field of medical research should investigate further is like, how much is this making a difference? When we look at our populations, it seems like, we went from having this number, and now that we have a mandate, we have nearly 97% of our population vaccinated. But is that a result of the mandate, or is that a result of continued education about the vaccine, continued exposure to the disease itself? That information we really don't know. And so something that I would encourage any of you, or maybe Dr. Kim and I can start pursuing, but something that I think is important for us to know as we move forward, as public health organizations make decisions about things like this in the future. And one final thing that I did want to touch on, something that with respect to the mandate of vaccines, is that in the U.S. military, we have had a number of people that have been discharged from active duty service because of vaccination. So this is something that is weighs heavy on our minds as military providers, because ultimately we want to provide good care for our patients, and it is hard when kind of these administrative things are what are potentially stopping somebody from serving in the military that would otherwise want to. And so as primary care providers, again, it just empowers us to apply these communication strategies to get people to a point where they're willing to get the vaccine, because ultimately that is what's going to be best for their health, but it also is something that can keep them serving in this great military that we have the privilege to serve in as well. So with all of that, thank you so much for your time. We really appreciated putting this presentation together. We're excited to watch the other presentations here at AMSUS, and we look forward to answering questions of yours during our scheduled Q&A.
All right. Thank you for joining us. And what follows are some of our references for you to look at as well. Thank you again.